having Mayor Lightfoot leading the city at the time of the pandemic of the century, and I will forever be grateful for her leadership at that time, her emphasis on equity, not just as a word, but in terms of action related to COVID, her work to really bring people together, whether those are the mayors across Metro Chicago, whether that's the department, whether that's the community-based organization community or the philanthropic community. We really came together as a city to fight this common enemy, and I think that was in no small part due to her leadership. We spent 3 years making decisions together related to COVID, and I really appreciated that those decisions were made based on science and on the most important things that we knew about COVID, what were needed in public health, but that they were also made bringing in business partners, really thinking about how do we work across sectors, think not just about the direct impacts of COVID, but the indirect impacts. And so I think decisions like making sure that during the pandemic, we're also focused on food, and we're focused on internet, and we're focused on some of the housing pieces in new ways. These are the things that help people live healthy lives. I think outside of COVID also, there were many, many advances. A big one would be in the behavioral health space, mental health and substance use. We went from serving about 3,600 Chicagoans to over 74,000 Chicagoans between 2019 and 2022 with no barrier, high quality mental health care in every one of Chicago's 77 neighborhoods. We, for the first time, are diverting people who are arrested with a substance. Instead of moving into the criminal justice system, they have the opportunity to instead seek treatment. We embedded mental health professionals in the 911 response for the very first time. We've grown our substance use and mental health work in ways that I think are transformational for the city. I think that for the next 5 to 10 years, we are going to continue to grow a lot of the initiatives that were incubated during Mayor Lightfoot's time. So I'm anxious to see further expansion of the CARE program. I'm excited to see the growth of Family Connects. That's that program where we're working on maternal mortality, infant mortality, just needing to connect young families to resources in Chicago. We want that to be available for every baby born in the city of Chicago, and we have a plan to get there over these next few years. But I think broadly, this administration, and particularly during the COVID response, has been about trying to listen authentically to communities. It's been about bringing data and saying we don't always have all of the answers as government. There's a long history of disinvestment in particular parts of Chicago, and I think that this administration has worked hard to reverse some of that very long history. And it's been just wonderful being able to be the commissioner with a mayor who, even though she didn't know that much about public health when she came in, boy did she learn fast, and boy did she take the principles of public health and use them to make this a stronger, healthier city.